accept.
All right, so what is really going on here? How much of this is lefty-righty tennis, GOP trying to point out process flaws, which we all know are there, and how much of this is a valid reason for concern when you look at this legislation? The answer is probably somewhere in between. Joining us now, Republican Congresswoman Marsha Blackburn from Tennessee. Marsha, how do you look at this flipping, and how do you feel about this so-called Tennessee treat? Is this an equalization to a wrong that Tennessee was suffering, or is this another version of you scratch my back, I'll scratch yours?
You know, Dylan, the reason Tennessee needs that money is because they have a program that did fail. So what they're going to do is take money from a program that will fail to put into that. That's why you're seeing that take place. You know, in Tennessee, what they will say about situations like this with this bill, with this health care bill, is you can try to wash a pig, but you can't wash that pig. You can only get a little air freshener on it. And that's why you're seeing these last-minute deals trying to be cut.
Now, with that said, and correct me if I'm wrong, my understanding is that the entire Tennessee delegation signed the letter making that request. He's the only one that flipped his vote, but you and everybody else effectively said, yeah, we need that money. Is that true?
We have supported in the past DISH funding because the TennCare program, the public option experiment that took place in Tennessee from '94 up until today, they gave away the DISH payments. They received some extra funding through an 1115 waiver. It's a long process, but the point is this: if public option health care worked, if this expanded Medicaid worked, Tennessee wouldn't be needing the money. Tennessee would have extra money. The point is the program was tried, the program did not work, and that is why they come back to the federal government for this funding.
I guess the only thing that I would say in response to that is it a fair test of the public option, whether you look at the Massachusetts version of it or the Tennessee version of it, if you do it as a mandate, but you do it as a mandate without industry reform, that effectively, if you do it halfway, it's going to kind of be screwed up, but you almost have to do all of it, not half of it. Is that fair?
The point is that expanded Medicaid does not have a successful track record. Whether you're looking at Tennessee or at Massachusetts or at Maine, it just does not work. What would have been the better path to have traveled, and I will say this, we all agree that we need to see some health reform, both on the delivery and the insurance side, but this is not the path to travel. Drilling down, lowering those costs, that is something that needs to be done. Making certain that competition is inserted in the market, that the market is less confusing. There are plenty of bills that would do that, Dylan, that would not be shifting that burden to government first for government to decide who accesses the system.
And to that end, you and I both know, and you just referenced it, I think everybody in this country has acknowledged at this point that doing nothing is an absolute disaster unless you don't care about your children or the future of this country, because we are on a spending path that is disastrous. Again, you look today, I'm just looking at Tennessee today, the average family premium $11,550 by 2019. If you don't do anything, it's almost up to $20,000. I could show you state after state after state. Let me give you a little hypothetical. If this bill ends up being passed, is your inclination to try to fight for amendments that would create more competition, that would create more reform, to try to amend it over the next few years in a way that creates those things that you and I would talk about, or to attempt to try to rescind it in some fashion? What do you think is the better path forward for America? Improvement of this or rescinding this?
Right. Well, my goal is to make certain that we defeat this bill this weekend, and that is what my focus is right now. I think it's imperative that we return to look at some of those issues that we passed out of the House in 2006 on a bipartisan basis, where we dealt with liability reform, we dealt with some insurance accountabilities, we dealt with association health plans. Those are items that we have agreement on across state line purchasing of insurance.
Right.
There's agreement on that. And Dylan, the thing to do is to defeat this, to sit down at the table and say, let's begin again with the bills, the legislation that's already out there, and decide what we want to move forward first, so that we do increase coverage, get the costs down, get some competition, and make the process less confusing for all Americans.
Well, listen, I appreciate your helping us in the dialogue, and if whatever happens, I think everybody in America at least understands more of what the problem is and has a little bit more of an understanding of what some of our choices will be beyond, both with this legislation and beyond us, and you've helped us communicate that, and I appreciate it. Thank you, Martha.
Absolutely.
All right.